Hello everyone, our group 30 will present the topic biting behavior in toddler age group. This is Emily, Isla, Tim, who are belong in toddler age group and the teacher. The case scenario happened at a early learning center during the outdoor play. At the outdoor yard, Emily and Isla were playing at the sand pit while the teacher was reading a book with Tim nearby. Suddenly, Isla stood up and moved closer to Emily. After a few seconds, teacher heard Emily scream and cry. She approached Emily to check on her sudden change of emotion. She saw a bite mark on Emily's arm and decided to move both Emily and Isla out of the sand pit without any verbal warning. Emily showed the teacher the bite mark on her arm and gestured her finger to Isla, as Isla was the one who bit her. While the teacher was talking with Emily and checked on her bite mark, Isla screamed and shouted as she was moved away from the sand pit and her play got disrupted. After finished talking to Emily, teacher angrily shouting at Isla and told her to stop crying and demand an answer for her biting behavior. Isla continued to cry as the teacher kept questioning Isla and demanded an apology from her to Emily. After examining the case, I will analyze the teacher's response to Isla's biting behavior. According to Child Australia 2012, adults should respond calmly but firmly when dealing with children who have biting behavior. In this case, the teacher did not clearly communicate with Isla before removing her from the sandpit, causing a negative reaction from Isla's behavior as she screamed and cried due to being disrupted in her play and moving away from the sandpit. Moreover, positive interaction between teacher and children can guide children toward appropriate behavior, according to Australian Children Education and Care Quality Authority 2022. In this scenario, the teacher showed a negative reaction as she was angry while talking to Isla about her biting behavior, which made the situation worse and escalate Isla's unwanted behavior as she was non-stop crying. When adults indicate their angriness with the biting behavior, it may harm the children's development in self-confidence, and children might feel rejected and unwanted, according to Children Australia 2012. According to ASEQUA 2016, a positive relationship between teacher and children is the crucial key to support children's learning and development, promoting self-regulating skills and developing care and empathy for others around them. Why the teacher response to Emily is appropriate in this situation, as she calmly checked on Emily's bite mark and her emotional state, the teacher response to Isla was appropriate. The teacher's facial expression and her tone of voice while talking to a distressed Isla were unfit in this situation and provocatively contribute to revolting Isla's challenging behavior. As most toddlers do not have the developmental ready to understand empathy or compassion, the teacher demand for an apology from Isla to Emily did not support Isla in developing her awareness and making positive progress in her inappropriate biting behavior, according to Community Early Learning Australia 2023. Next, Nico will summarize the potential contributing factor to biting behavior in this scenario. Thank you.
Thank you, Lynn. We all understand biting is not an acceptable social behavior. However, it is a normal behavior for children under 3 years old. It is important to emphasize that a child who bites is not inherently bad. Biting is a very common developmental strategy for toddlers who express their needs or feelings when they are unable to do so verbally. Next, I will explore several potential factors contributing to biting growing up when children bite, a resource for early childhood educators by Bauer and Jeffrey and other related scholarly references. First, I will talk about the developmental factors. There are 4 main factors: limited self-regulation or self-control because they are still gaining those skills, limited of language development, teething, and oral exploration. Raguel de Aiteo in 1997 reflected that toddlers, unlike adults, lack of social and emotional skills to respond in an acceptable way. Clarify underlined that toddlers do not plan their actions. They respond to things as they feel at present. As they grow more aware of their surroundings, they often become less cooperative and more independent than they were as infants. They struggle with understanding that others are separated entities and get easily frustrated when situations don't unfold as expected. This frustration is a result of them learning and asserting sense of autonomy. However, their language and motor skills are still developing. According to the developmental milestones in 2018, children from 1 to 2 years old begin to use 1 to 2 word sentences, say their first name, and use many naming words. In this scenario, the child is in a dispute over a favorite toy in the sandpit and is able to express their ideas verbally. So she uses one of the most powerful tools she has, her teeth, to protect her toy, which show her frustration and power. Toddlers feel out of control and overwhelmed, often turn to any available method to ease their distress. For them, biting is a way to assert some control over their environment and manage their feeling of anxiety. When children are having teething, biting is a natural response to discomfort. In addition, Brian and Jeffrey declared teething can cause discomfort in the mouth. If a child has incoming teeth, they may experience pain, and biting down can soothe their gum by applying pressure. At last, Ramin in 2006 noticed that toddlers explore their environment orally from infancy, finding comfort and control in this process. However, due to their lack of physical control, they may bite, scratch, or pinch out of frustration. As they develop better control over their movements, the likelihood of biting decreases. Now let's have a look at the environmental factors that cause biting. As you can see in the slide, the child behaviors is influenced by their environment. Engaging activities reduce the likelihood of biting, while boredom or frustration increases. Early childhood setting, often busy and noisy, require a balance of active and quiet space to support children's diverse play needs. Solitary and parallel play dominated from 12 months to 30 months, with cooperative play developing later. Smaller groups and well-distributed activities helps. Insufficiency toys or inappropriate materials or may also trigger biting. As can overstimulation from bright colors and extensive decoration. So parents and educators having the knowledge and understanding the children's development and environmental factors can better assist in their biting issues. I'll put all the reference by the end. Now I will pass the floor to Sunette to explore the effective strategies and the management plan for biting. Thank you.
Hello, everyone, and welcome to today's presentation on strategies to deal with biting in early childhood setting. Biting can be a challenging behavior for both educators and parents to manage. But with the right strategies in place, we can effectively address and prevent biting incidents. At first, we need to understand why children bite. Biting is a common behavior among young children, often occurring during periods of teething, frustration, or exploration. It's important to recognize that biting is a normal part of development and usually not intended to cause harm. Given here are some of the strategies we could use in such situations. Immediate response. React calmly but firmly to the biting incident. Separate the child involved and attend to the child who was bitten. Provide comfort and first aid if needed. When a biting incident occurs, it's essential to respond calmly and promptly. Remove the child from the situation and provide immediate support and comfort to the victim. Avoid blaming or shaming to the child who bit, as this can escalate the situation. This strategy supports by literature emphasizing the importance of immediate and appropriate responses to biting incidents to prevent escalation and ensure the safety and well-being of children involved. Modeling and teaching. One effective strategy is to teach children alternative behaviors to biting. Encourage verbal expressions of feelings, such as using words to communicate needs or asking for help. Model appropriate social interactions and problem solving skills through role playing and storytelling. Using simple language to explain the consequences of biting and offering alternative ways to express emotions aligns with social learning theory, which suggests that children learn through observation and imitation of others' behaviors. By modeling appropriate social interactions and problem solving skills, educators can help children learn alternative, non aggressive ways to communicate their needs and manage frustration. Positive reinforcement. Positive reinforcement can also be a powerful tool in advertising biting behavior. Praise and reward children when they demonstrate appropriate behaviors, such as sharing, taking turns, and using gentle hands. This helps reinforce positive actions and encourages children to continue behaving in a respectful manner. Praising and reinforce positive behavior such as sharing, taking turns, gentle touches, expressing emotions verbally. By providing a positive reinforcement for desirable behaviors, educators can increase the likelihood of those behaviors recurring and discourage biting incidents. Consistency. Setting clear expectations and boundaries is crucial for preventing biting incidents. Establish consistent rules and routines within the early childhood setting and communicate these expectations to children in appropriate age appropriate ways. Consistently reinforce Consistently enforce rules and consequences for biting behaviors across all caregivers and settings. Enforce rules and consequences for biting behavior consistently is essential for promoting a supportive and predictable environment for children. Also, ensure that all the staff members are aware of the strategies being employed and are being implemented them consistently. Consistency is a fundamental principle in behavior management as it helps children understand expectations and foster a sense of safety and security. Observation and prevention. Another strategy for preventing biting in behavior is to observe the child closely to identify potential triggers. These triggers may include fatigue, hunger, overstimulation, or frustration. By paying attention to the child's cue and behavior patterns, we can gain insight into what may lead to the biting incident. Identifying triggers for biting behaviors and intervening proactively aligns with the ecological system theory, which emphasizes the influence of environmental factors on individual development. Once potential triggers have been identified, it's essential to intervene proactively to prevent biting behaviors. This may involve providing appropriate snack or meals to address hunger, offering nap time or quiet time for rest and relaxation, or redirecting the child's attention to a different activity before a biting incident occurs. Communication with parents. Finally, collaboration with parents is essential in addressing biting behavior. Maintain open and honest communication with families, sharing information about incidents and strategies used in the classroom. Effective communication with parents also ensures a comprehensive understanding of each child's needs that could be used to tailor interventions accordingly. Encourage parents to force positive behaviors at home as well, and seek support for early childhood professionals if needed.
Hello everyone, I'm Abhirami. Zeenat explained the strategies we could implement with biting in early childhood setting. I will be justifying these choices of strategies based on relevant literature and theoretical frameworks. Addressing biting behavior in early childhood setting aligns with belonging, being, and becoming. Early years learning framework and the Victorian early years learning and development framework. These frameworks emphasize creating safe, respectful, and supportive environments where children can develop positive social skills and emotional resilience. Children's well-being can be affected by all their experiences within the outside of their early childhood settings. To support children's learning, it is essential that educators attend to children's well-being by providing warm, trusting relationships, predictable and safe environments, affirmation and respect for all aspects of their physical, emotional, social, cognitive, linguistic, creative, and spiritual being. When dealing with biting in early childhood setting, using different theories and methods is important as it helps us understand and handle the behavior better. There are lots of different ideas that can help teachers and caregivers to solve how to handle biting. Attachment theory, developed by John Bowlby, indicates that it is really important for children to feel close the attachment and feel safe with the people who take care of them. When we know how children connect with others, we can understand why they act the way they do, like biting. Teachers and adults can help children feel safe and comforted when they are upset, which might help stop them from such behaviors. Insecure attachment can lead to challenges for young people's well-being, while disorganized attachment increases the risk for poor relationships, ongoing behavior problems, and mental health. Social cognitive theory, developed by Albert Bandura, addresses how children learn to get along with others, handle their feelings, think, and act. It also shows us how children discover how to control themselves and makes them want to do things. Behavior theory, developed by Skinner, is about how rewards and punishments influence what we do. In terms of biting, teachers can use positive reinforcement like rewards or praise to encourage children to do the right things, getting the children who bite to do things differently, like using gentle touches or talking instead of biting. Bioecological theory, developed by Yuri Bronfenbrenner, indicates that different environments affect how children grow and learn. It addresses about things like the places they are in every day and how those places work together. When dealing with biting behavior, teachers can think about the places children spend time, how they interact with friends, and who supports them. This helps them to look at everything that might be affecting the behavior and find the best way to help observation and prevention. Partnership with families is really important. With the support from family and the collaboration between family and the early childhood professionals, the effective behavior management strategies can support children with challenging behavior. Through working partnership families, the early childhood professionals and parents can understand the causes and triggers of the challenging behavior. Discuss the consistent and effective strategies to support children in their learning, development, and well-being. Victoria Early Years Learning and Development Framework indicates that early childhood professionals create a welcoming and inclusive environment where all families are encouraged to participate in and contribute to experiences that enhance children's learning and development. Actively engage families and children in planning for ongoing learning and development in the service at home and in the local community. Establish partnerships where information sharing support families, confidence identifies what families do well, and recognize the family's critical importance in their child's life. I have been able to demonstrate and justify our choices for the strategies using theoretical frameworks.
Let's go back to the beginning of the scenario. The teacher checked on Emily and Isla as she saw Isla were approaching Emily for some reason. By immediate response to the children's action, the teacher was able to prevent Isla from biting Emily as they were fighting over the orange cup. The teacher offered Isla an alternative way to look for another orange cup in the yard to relieve her frustration, which led to the biting behavior. Through the positive interaction, teacher calmly and firmly reminding Isla that biting hurt and that was not an appropriate behavior. Teacher also use positive reinforcement to promote positive behavior during children's playplays, as she encouraged them to use the word and take turns with their friends and praise them when children demonstrate appropriate behavior.